Welcome to this brief intro educational video on bipolar disorder. Bipolar disorder type 1 occurs in both males and females. Clients with bipolar type 1 present with a history of the characteristic high-lows associated with the manic and depressive phases of the disorder. Rapid cycling bipolar, which is described as episodes occurring 3, 4 or more times per year, occurs more frequently in females. Bipolar patients experience one or more manic or mixed episode, usually accompanied by a major depressive episode. Bipolar disorder type 2. Bipolar type 2 occurs more frequently in females. Clients with bipolar type 2 present with a history of depression, which alternates with periods of hypomania, which is less destructive and intrusive than full mania, which occurs in type 1. Bipolar disorder in children and adolescents. Children with bipolar disorder may initially be diagnosed with ADHD, schizoaffective disorder, disruptive mood dysregulation disorder, or conduct disorder. Bipolar disorder in children is more pervasive and harder to manage than adults. Diagnosis of bipolar. As with any mental health disorder, clients presenting with symptoms suggestive of bipolar disorder must have a thorough H&P. Medical disorders which can cause cognitive and mood disturbances such as hypothyroid, Cushing's, seizure disorders, vascular disorders, and substance abuse must be assessed. Differential of depression or schizophreniform disorder must be determined. Cyclothymia is a period of at least 2 years of numerous periods of hypomanic and depressive symptoms. Signs and symptoms of manic episodes. Some people with bipolar disorder will have episodes of mania or hypomania many times throughout their life. Others may experience them only rarely. Signs and symptoms of a manic episode include excessive happiness, hopefulness, and excitement. Sudden and severe changes in mood, such as going from being joyful to being angry and hostile. Restlessness. Rapid speech and racing thoughts. Increased energy and less need for sleep. Increased impulsivity and poor judgment, such as suddenly quitting your job, making grand and unattainable plans, reckless and risk-taking behavior, such as drug and alcohol misuse and having unsafe or unprotected sex, feeling like you're unusually important, talented, or powerful. Psychosis, experiencing hallucinations and delusions in the most severe manic episodes. Most of the time, people experiencing a manic episode are unaware of the negative consequences of their actions. With bipolar disorder, suicide is an ever-present danger. Some people become suicidal in manic episodes, not just depressive episodes. If a person is having an intense manic episode, especially if they're experiencing hallucinations and delusions, they may need to be hospitalized to protect themselves and others from possible harm. Bipolar disorder, formerly known as manic depressive illness or manic depression, is a lifelong mood disorder and mental health condition that causes intense shifts in mood, energy levels, thinking patterns, and behavior. These shifts can last for hours, days, weeks, or months and interrupt your ability to carry out day-to-day tasks. There are a few types of bipolar disorder which involve experiencing significant fluctuations in mood referred to as hypomanic, manic, and depressive episodes. However, people with bipolar disorder aren't always in a hypomanic, manic, or depressive state. They also experience periods of normal mood known as euthymia. Manic episodes. A key feature of bipolar 1 disorder is manic episodes. To meet the criteria for bipolar 1 disorder, you must have had at least one manic episode in your life for at least a week, with or without ever experiencing a depressive episode. Mania is a condition in which you have a period of abnormally elevated or irritable mood, as well as extreme changes in emotions, thoughts, energy, talkativeness, and activity level. This highly energized level of physical and mental activity and behavior is a change from your usual self and is noticeable by others. People who are in manic states may indulge in activities that cause them physical, social, or financial harm, such as suddenly spending, or gambling extreme amounts of money, or driving recklessly. They also occasionally develop psychotic symptoms, such as delusions and hallucinations, which can cause difficulties in distinguishing bipolar disorder from other disorders such as schizophrenia or schizoaffective disorder. People with certain types of bipolar, such as bipolar 2 disorder, experience hypomania, which is a less severe form of mania. It doesn't last as long as manic episodes, and it doesn't interfere with daily functioning as much. Depressive episodes. During a depressive episode, you experience a low or depressed mood and/or loss of interest in most activities, as well as many other symptoms of depression, such as tiredness, changes in appetite, feelings of worthlessness and hopelessness. Why is bipolar disorder no longer called manic depressive illness? In the last few decades, the medical world, especially the field of psychiatry, has intentionally made a shift from using manic depressive illness or manic depression to describe bipolar disorder. There are several reasons for this shift, including healthcare providers used to use manic depression to describe a wide range of mental health conditions. As mental health condition classification systems, including the Diagnostic and Statistical Manual of Mental Disorders, DSM, have become more sophisticated, the new term bipolar disorder allows for more clarity in diagnosis. There's a lot of stigma and negativity associated with the terms manic and mania, especially due to the use of maniac. Similarly, people use the term depression casually to describe periods of sadness that don't qualify as clinical depression. Using bipolar disorder takes the focus away from these two words. Bipolar disorder is more of a clinical medical term and less emotionally loaded than manic depression. The term manic depression excludes the cyclothymic or hypomanic bipolar 2 disorder versions of the condition. What are the types of bipolar disorder? There are 4 types of bipolar disorder, including bipolar 1 disorder. People with bipolar 1 disorder have experienced one or more episodes of mania. Most people with bipolar 1 will have episodes of both mania and depression, but an episode of depression isn't necessary for a diagnosis. The depressive episodes usually last at least 2 weeks. To be diagnosed with bipolar 1, your manic episodes must last at least 7 days or be so severe that you need hospitalization. People with bipolar 1 can also experience mixed states, episodes of both manic and depressive symptoms. Bipolar 2 disorder, people with bipolar 2 experience depressive episodes and hypomanic episodes. But they never experience a full manic episode that's characteristic of bipolar 1 disorder. While hypomania is less impairing than mania, bipolar 2 disorder is often more debilitating than bipolar 1 disorder due to chronic depression being more common in bipolar 2. Cyclothymic disorder, cyclothymia. People with cyclothymic disorder have a chronically unstable mood state. They experience hypomania and mild depression for at least 2 years. People with cyclothymia may have brief periods of normal mood, euthymia, but these periods last fewer than 8 weeks. Other specified and unspecified bipolar and related disorders. If a person doesn't meet the diagnostic criteria for bipolar 1, 2, or cyclothymia, but has still experienced periods of clinically significant abnormal mood elevation, it's considered other specified or unspecified bipolar disorder. What's the difference between borderline personality disorder and bipolar disorder? While borderline personality disorder, BPD, and bipolar disorder have similar symptoms and are often confused for each other, they're distinct conditions. BPD involves a long-standing pattern of abrupt moment-to-moment swings in moods, behavior, and self-image that are often triggered by conflicts in interactions with other people. Non-suicidal self-injury is also common in BPD, but not in bipolar disorder. Bipolar disorder is different from BPD because it involves distinct, longer-lasting episodes of mania, hypomania, and/or depression. Several things can trigger manic or depressive episodes, such as sleep changes, stress, medications, and substance use. Who does bipolar disorder affect? Bipolar disorder can affect anyone. The average age of onset is 25 years, but more rarely, it can start as early as early childhood or as late as in your 40s or 50s. How common is bipolar disorder? Bipolar disorder affects approximately 5.7 million adult Americans, or about 2.6% of the US population. Symptoms and causes. Learn the signs of bipolar disorder. What are the signs and symptoms of bipolar disorder? The defining sign of bipolar 1 disorder is a manic episode that lasts at least 1 week, while people with bipolar 2 disorder or cyclothymia experience hypomanic episodes. But many people with bipolar disorder experience both hypomanic/manic and depressive episodes. These changing mood states don't always follow a set pattern, and depression doesn't always follow manic phases. A person may also experience the same mood state several times, with periods of euthymia in between before experiencing the opposite mood. Mood changes in bipolar disorder can happen over a period of weeks, months, and sometimes even years. An important aspect of the mood changes is that they're a departure from your regular self, and that the mood change is sustained for a long time. It may be many days or weeks in the case of mania, and many weeks or months in the case of depression. The severity of the depressive and manic phases can differ from person to person and in the same person at different times. Signs and symptoms of manic episodes. Some people with bipolar disorder will have episodes of mania or hypomania many times throughout their life. Others may experience them only rarely. Signs and symptoms of a manic episode include excessive happiness, hopefulness, and excitement. Sudden and severe changes in mood, such as going from being joyful to being angry and hostile. Restlessness, rapid speech and racing thoughts. Increased energy and less need for sleep. Increased impulsivity and poor judgment, such as suddenly quitting your job. Making grand and unattainable plans. Reckless and risk-taking behavior, such as drug and alcohol misuse and having unsafe or unprotected sex. Feeling like you're unusually important, talented, or powerful. Psychosis, experiencing hallucinations and delusions in the most severe manic episodes. Most of the time, people experiencing a manic episode are unaware of the negative consequences of their actions. With bipolar disorder, suicide is an ever-present danger. Some people become suicidal in manic episodes, not just depressive episodes. If a person is having an intense manic episode, especially if they're experiencing hallucinations and delusions, they may need to be hospitalized to protect themselves and others from possible harm. Signs and symptoms of hypomania. Some people with bipolar disorder have milder manic-like symptoms. This is called hypomania. With hypomania, you may feel very good and find that you can get a lot done. People with hypomania can often function well in social situations or at work. You may not feel like anything is wrong during a hypomanic episode, but your family and friends may notice your mood swings and activity level changes and think that they're unusual for you. After hypomania, you might experience severe depression. Signs and symptoms of depressive episodes. The symptoms of depressive episodes in bipolar disorder are the same as those of major depression. They include overwhelming sadness, low energy and fatigue, lack of motivation, feelings of hopelessness or worthlessness, loss of enjoyment of things that were once pleasurable for you, difficulty concentrating and making decisions, uncontrollable crying, irritability, increased need for sleep, insomnia or excessive sleep, a change in appetite causing weight loss or gain, thoughts of death or suicide, suicidal ideation. Pharmacological management includes mood stabilizers. Examples of mood stabilizers include lithium, lithobid, valproic acid, depakena, divalproic sodium, Depakote, carbamazepine, tegretol, equetro, others, and lamotrigine, lamictal. Antipsychotics. If symptoms of depression or mania persist in spite of treatment with other medications, adding an antipsychotic drug such as olanzapine, Zyprexa, risperidone, Risperdal, quetiapine, Seroquel, aripiprazole, Abilify, ziprasidone, Geodon, lurasidone, Latuda, or asenapine, Safris, may help. Can prescribe some of these medications alone or along with a mood stabilizer. FDA medications approved for treating bipolar disorder include olanzapine, quetiapine, lurasidone, and cariprazine. Antidepressants can add antidepressant to help manage depression. Because an antidepressant can sometimes trigger a manic episode, it's usually prescribed along with a mood stabilizer or antipsychotic. Careful for induction of mania asterisk. Wellbutrin is used often to augment for bipolar depression, works on dopamine and not serotonin, doesn't pose a risk of mania. Antidepressant antipsychotic. The medication Symbyax combines the antidepressant fluoxetine and the antipsychotic olanzapine. It works as a depression treatment and a mood stabilizer. Anti-anxiety medications. Benzodiazepines may help with anxiety and improve sleep, but are usually used on a short-term basis.